Five.
Good afternoon, everybody. Welcome to the Liz Live Show. We have a very special guest today and a very special show, and you can kind of see her. I mean, we're a low-budget show here, but, we're doing the best we can. This is a very exciting show because, number one, it's the first time I've been able to actually have a guest on since the whole coronavirus shutdown, so I decided to get creative and invite my very good friend and colleague, Dr. Shaila Day. She is with us, although she's on a screen that's not as big as the regular news media. I'm going to do the best I can to make sure you guys can see and hear her. So I want you guys to let me know if you have any problems hearing Dr. Day, to type on the screen. I have her mic'd on the iPad, but if anyone has any trouble hearing, I want you guys to let me know. And, I thank everybody for supporting the show. And as a lot of you know, I am a marriage and family therapist and mental health counselor. And just like everyone else, have been quarantined to working from home. And I do believe that it's a time when us therapists need to step out into the community and reach out to people. And so I've been doing this live show every single day for the last 3 weeks so that everyone has an outlet to really talk and share about what's going on and how they're feeling. And this is the first time that I've been able to not only have a guest, but have someone who is a real live doctor who's working on the front lines with people who are, coming down with the COVID virus. And she's got some really great tips for all of us on how to stay safe and, how to protect ourselves. And I know there's, people have so many questions. So without further ado, let's say hello to Dr. Shaila Day.
Hello.
Hi, Dr. Day. Thank you so much for doing this for me and for my viewers, because it's such a scary time, and we're all hearing so much conflicting information, and we don't know what to believe, and it feels like every day, we watch the news, we listen to the news media, and we're getting just completely different different information. And, every day it's been changing. So first of all, I want to extend a big thank you to you for literally putting your life on the line to save all of us. And I think, you guys need to hear that right now, because this is really a scary time for our country. So our first viewer writes in a question, and she's asking us, what is truthfully the best way to protect ourselves? Because we're hearing so many different things.
Right. So, essentially, any type of communicable disease or anything that you can catch from someone else, your best defense is always to wash your hands. And, we're talking 20 seconds, really vigorously rub it, hot water and soap. That's usually the best thing to do. But for this particular virus, it's kind of like it's so new. A lot of things that we know about typical coronaviruses, we're not able to fully hang our hat on that. So I think right now the social distancing is good. Washing your hands, staying away from other people if you can, just stay in your home unless you need to go out, keeping your immune system strong, so eating healthy, all those things that people in the medical field have been telling you guys for years to have a healthy diet. Natural anti-inflammatory things like turmeric and ginger, vitamin C, all those are going to be paramount right now.
So are you saying, like, because one thing that I've noticed, and I'm holding, you can't see, but I'm holding you up, like I'm hugging you, I'm holding you. What we all really are confused about, like, one, I've been asking this question on the show the whole time, like for the last 3 weeks, like, why is the medical community not talking about building up the immune system, and we're just talking about how to avoid it?
Well, my theory on that is typical Western medicine, the way it's practiced, is rooted in being reactionary, not proactive. If there is something wrong with the body, then we do something to correct it. So you have this, and we're going to do this to counteract that. I would say that more other ancient medicines and even osteopathic medicine, which I am a doctor of, are more geared towards or rooted in preventative medicine and using the body as a means to heal itself. And if you're starting out with a good foundation to begin with, then it's less likely for other disease to kind of take hold and cause issues in you, if you will. So I think that's why the mainstream way we practice medicine in America, or sort of Western medicine, is to be more reactive to things instead of proactive. And there has been a surge in the past probably 10 to 15 years of more wellness and wholeness and alternative forms of medicine and things like that. But that's a good question. That you're right. That's not been out there a lot. It's about how to build up your immune system, which we know is very paramount. We know that
Right.
decreasing your stress, getting good sleep, filling your body with good building blocks so that your immune system can function properly is definitely important. So I don't know the real reason, but that's my theory. My theory is that that's pretty much just how the medicine works in this country. It's just more proactive.
Right. And I see, and of course,
more reactive.
my dog Coors always has to put his 2 cents in. That's the hard part about working from home. So I wanted to ask you. There's so many questions that are coming on the screen. So somebody's asking who should and should not wear a mask. And I know that every day these things are changing. And, can you clarify like the whole mask issue? Should we wear them? Should we not wear them? What's the deal with that?
That's a very good question because if you would have asked me this about weeks ago, I would have said, no to the mask, because as you're putting it on, you're putting more bacteria or viral particles into your face and things like that. But now that we know more information about this virus and that it's not only droplet, it's also perhaps aerosolized, meaning that just talking to somebody and their breath and the molecules in their breath could potentially infect you. We need to be wearing masks. Now,
Okay.
so I would say if you're going to go out in public, to go ahead and wear a mask. You probably could get away with a regular surgical mask, or you could wear an N95 mask. However, keep in mind that these masks are for single use only.
Okay, single use, guys. Make sure you remember that. It's very important.
So they're not to be worn for multiple hours at a time, multiple days at a time. So if you're going to go run an errand and you just have to go to the grocery store to stock up, or you're going to the drugstore to get your medications, or anything essential that you're doing, because really you're supposed to be in the house, then you will wear your mask for that period of time. When you come home, to wash your hands, then remove it, throw it away, wash your hands again. You're not going to wear this mask to Costco and wear the same mask later to pick up food at Papa John's. Like, you're going to wear a whole new mask. Because the longer you wear the mask, you're breathing in it, and the moisture from your breath is the integrity of the material that the mask is made out of.
Of course.
Now you've broken down that barrier that's supposed to protect you. So that's why you can't use the mask over and over again.
Okay, so what about, like, I've heard now that some people are saying, you can wear like anything, like a scarf or something to cover your nose and mouth. What do you think about that?
I do not think that's probably good advice, just because the masks are made where the pores in it have been tested against different particles, and clothing, is woven. It's all types of different sizes, and the way it's constructed. I don't think that would be as good, you know? So I think if it gives you a sense of security, then I suppose you could wear it, but it wouldn't be the same. It's not going to be equal to wearing an actual mask.
I mean, is it better than nothing? Or should we, because, we don't want to reinfect ourselves. And I think that, something that we're all having to learn right now is we all have to learn how to be extremely disciplined and,
Right.
change this sort of, I don't want to say laissez-faire attitude we've had about some of this, but in some ways we haven't paid close attention to all these things.
No.
So with gloves, I mean, can you clarify also about wearing, because I've seen people wearing like winter gloves, and I'm thinking, well, that seems ridiculous, but people are so scared and we're getting so much conflicting information.
Right.
So can you talk a little bit about gloves?
So let me just address the cloth about the mask. So I think if you are trying to just protect yourself the best way you can, I think wearing a cloth or a scarf over your face would be okay, but you're going to have to wash it. You wear it to the store and you have to come back in and wash it right away. You're not going to be able to reuse it unless you wash it and sanitize it. So it's going to have to be washed in like hot water with good detergent to get all the different particles out of it. So that would be better than nothing.
Okay.
Now in terms of gloves, I don't agree with gloves at all in public. I think you'd be better off just having your hands and some hand sanitizer handy. So, the hand sanitizers that you can hook to your belt loop or to your whatever, your pocketbook, that would be better, because the gloves are going to catch any sort of bacteria. So if you're going to wear gloves, you're going to need to be washing the gloves as well. So you might as well just get rid of the gloves altogether and just, have your hands out. So, but when you get the shopping cart, you're going to sanitize that down, go through the store, come up with a regimen. Number 3. So for 3 items you get and put in the cart, then go ahead and sanitize again. Let it dry, then keep going about your business. Get another 3 things, and then do that again. And especially when you put the keypad to pay and you're exchanging money with the cashier, you definitely want to make sure you're sanitizing your hands, or even sanitizing the keypad before you use it. But I don't think the gloves are really necessary. It's probably going to make things dirtier than anything else, because if you're not washing the gloves off, you're going to still infect yourself. And then the gloves are they're for single use as well. So, they're not meant to be worn over and over again. And even if you're going to wear winter gloves, all that fabric is getting all the bacteria. So not only coronavirus, you're getting all kinds of other stuff that's out there. So I wouldn't even use the winter gloves. I mean, that doesn't...
Okay, yeah, and I think just because people are so anxious, they're so scared, they're just trying to do whatever they can. But I think that gloves, to me, unless you're, working in a medical facility or something, really wouldn't, I see what you're saying. You could actually make it worse for yourself. And I think that's the fear about, people not understanding that if you're wearing a mask and gloves, you can only, like you said, one time only, and so you might just be better off washing your hands. Now, somebody was asking me, what is it like for you? What are you seeing in the COVID patients that you're treating? And, I know it's really scary because, at first they were saying, oh, well, it's really only affecting people over 65. But you've told me off camera that you've seen a lot of different types of people come in.
Yes. So, I mean, in general, it's just it's really scary. Because, just the way you're trained as a physician, it lends itself for you to be able to sort of process and compartmentalize different things as you're treating the patient. You got to have your wits about you and a sense of calm so that you can focus on the task. So, that is present always. Whenever somebody is sick, you go into kind of survivor mode and you go into to help them. And, most diseases follow a typical pattern. You come in with one thing and it may get worse, and we kind of know what to expect. So the scariest thing for me with these patients is they're coming in. They're not elderly. They're in their 40s or late 30s, around my age. Healthy, no medical problems. They may be maybe 15 pounds overweight. That's it. Don't smoke. Don't really drink. Pretty healthy. They come in and I'm having a conversation with them as I'm doing my interview, and as the day goes on, I'm getting calls from the nurses about different vital signs deteriorating just like that, despite everything that I know to do to help these particular symptoms and this, constellation of disease, the way the patient presents. Despite everything I know to do, the patient is still deteriorating in front of my eyes, and it's happening so quickly. So that's the scariest part. And then once that is happening, I know that there is not much else that we can do because it kind of reaches a point of no return.
That is so scary.
It's really scary. And what I mean by that is specifically when patients are coming in with the low oxygen, we call it hypoxia or hypoxemia. When they're coming in requiring, say, 2 liters of oxygen to maintain their saturation to 98%, which is good. I'll just say that. So I'm like, okay, I'm okay with that. I'm okay with that. Vital signs look all right. But once you're requiring more and more oxygen and you don't have a history of respiratory failure and, you're not able to breathe, that tells me that you've got so much lung damage that your lung tissue is not able to exchange oxygen. And the next thing for us to do is put you on a mechanical ventilator, which you put a tube down your throat and have the machine sort of breathe for you. But even with that doesn't always fix you. And so that is the scariest part. And like I said, these patients are relatively healthy. Some of them exercise. They're like athletes. So it's not just, people who have multiple medical problems and that is not the face of this at all. It's pretty much anyone.
Right, and I think that there's that's part of the problem where there's been so much information. I mean, I felt like you did in the beginning, and I thought, oh, this is nothing. This is no big deal. It's all sensationalized. I'm not changing. I'm going to keep going to work, and then, after the first week, I was like, wow, this is really getting serious. And now we see. It's like every day, it's like a nightmare. I mean, it just keeps getting worse and worse. And I have a colleague here, Dr. Metcalf. Hi, Dr. Metcalf. And he is asking a very interesting question that I don't totally even know what one of the words means, but maybe you do. What do you know, Dr. Day, about coronavirus serological testing, including the CRISPR gene testing?
Ooh. I don't know about that at all.
I don't. I'm sorry, Dr. Metcalf. I don't know anything about that either. I mean, I know that the testing, why don't you talk to that? Like, what kind of testing is available and how is that changing?
Well, what I know about the testing is that they're testing different specific genome to the virus and its different particles. And we're doing it with PCR, which is a way to identify certain proteins. So that is the testing that they're doing, and they have different cartridges that fit. And once it, so basically we have like a template for what the viral particles that we're testing for look like, and you're putting in all of the material from the test in that machine or that device, and once it's a match, then you know that it's a positive test. But I don't know anything about that particular genome testing that you're speaking of.
Okay.
And honestly, I've not done much research on the mechanism of the test. I've just been ordering the test and looking at the clinical picture. So I apologize for that. I don't know much about the technicality of the test.
No, that's okay. That's.
But I do know initially when we started testing where I work, there was a whole process, and we had to go through the Department of Health initially, and we had to get a approval whether to send the test or not, which was taking a long time. Now we're able to use a commercial lab to do the test, and we're getting the results back within 24 to 48 hours, sometimes the next day. And now I don't know if the facility I work at has the point of care test, which is coming back in I think 15 minutes. We don't have that one. But we can at least have the test that's able to come back within at least 2 days versus a week or a week and a half, like originally it was.
Okay, so I have an interesting question from a chiropractor, and he writes that, it's hard for him to get gloves and he has to ration them. And can you speak to, the physicians like a chiropractor that have that kind of contact with people and, other physicians who are still going to work every day? What can they do?
Ooh, that's a good question, because I'm assuming that, as a chiropractor, you would need to wear gloves. I think unless you're touching bodily fluids, you probably would be okay just to wash your hands as much as possible and sanitize them. Now, the mask, that's where I don't think you can necessarily duplicate that, because you have to be able to block your nose and your mouth from getting those particles in, but your hands are easy to just kind of wash. So in terms of running out of gloves, I would use your clinical judgment as to where you think you need to use them if you're running out, and because I don't know about the supply and demand and all of that. But unless you're going to be touching someone who has bodily fluid, unless you're doing some sort of chiropractic procedure where you're near the face, where you would have to touch saliva or mucus from the nose or, tears from the eyes, you probably would be okay with not using any gloves, just washing your hands really well. But I don't think we can really get around the mask situation. Now that I would definitely strongly advise, especially if you're going to be in close contact with people.
So for a chiropractor, it would be better, he should be more worried about the mask than the gloves.
Right.
And especially like if he's doing like neck adjustments or something, and he could be near the face, it's wash your hands. And so he says, thank you, doctor. So the next question, and this is the good basic one, is just, how exactly does the virus spread? Can you separate the facts from fiction? Which, I think, go ahead, Dr. Day. Why don't you go ahead and speak to that? That's a good bottom line question.
So basically, the viruses are very fascinating, I think, microbes, because they utilize the host, you or whatever animal it decides to infect, to recreate itself, and use your energy to cause disease in your own body. Wow. So if you come in contact with the virus as a whole, complete structure, it fuses with its target cell. In this case, the coronavirus fuses with your respiratory passages, and it's specifically into the lungs. And it starts to fuse itself with the cell, and then gets into the cell and gets into the nucleus, where your cell makes different DNA and RNA to make proteins, which are the building blocks of what the virus is made out of. So it uses you to make all these different pieces. So say it makes, for example, if you're going to compare it to something, say you're going to make its arm, its leg, and its head, and its teeth, and all these things. And once those all come together, it gets extruded out of the cell and then goes to infect more and more cells and makes. So by the time you know it, all your cells are making all these different particles, and it's all over the body. Now, that's how you would get it if you got a droplet or got it from the air, or someone sneezed on you or coughed on you, or you're just breathing and you inhaled it in. Now, in terms of the touching of the particles, the different pieces may be together on, the doorknob. Then you might touch your nose, and then you might touch the light switch, and then you might touch your steering wheel. So by the time you touch all these different surfaces, you've gotten contact with all the different pieces that need to be to make one, and then you touch your nose or your eyes or what have you, and now it's able to combine itself and then infect your cells.
That is fascinating.
Isn't it fascinating?
It is fascinating.
I mean, when it comes into a disease and things like that, and you're hurting, you're suffering, you may die, that part's not fascinating. But just the way that this, the viruses do that, I think is just so fascinating.
It really is.
That is actually the fact is that is how it's spread. That's how they replicate. They use the host to recreate itself and spread. And its goal is to keep you alive, though, because it wants to continue to replicate and make as many copies as it can and infect you. But sometimes the body, in its effort to clear itself of the infection, has a dysregulated response to infection. And that's what we're seeing with coronavirus. With some viruses, the body will do a little something, you'll feel sick, but and eventually it'll be able to recognize the particles, get rid of them, and you go on about your business. It makes antibodies. The next time you see the virus, it recognizes it, and the response is swifter, and then you're not as sick as you were before.
So someone had just asked, if a person contracts coronavirus, survives it, can you catch it again? And that's from Derek McDowell. Hi, Derek. Thank you for your question.
You definitely can catch it again.
You can.
Definitely. You can.
Oh my gosh, that's not good.
And I think right now, because this particular strain is so new, we don't know what the antibodies are, if the response will be worse the next time or if it will be a milder infection. But you definitely can catch it again. I mean, it's just like with the flu, you can catch it multiple times within the season.
Well, that being said, I mean, the social distancing, the wearing of masks, and I mean, how are we ever going to survive
back
from
to
all
some
this?
normalcy? Yeah, honestly, I don't know, because originally I was like, okay, well, most coronaviruses are done by, the time it starts getting warm, May, June, we should be good until, this coronavirus season and flu season starts up again, late September, October. But because this is such a different virus and it, is thought to have originally started in a totally different species, the bat, we kind of don't really know yet. I mean, we're kind of in it and trying to do the best we can. So at this, we're already behind the 8 ball every time because it's already out there. So we really just don't even know what to expect for the next period of time. And remember, you and I talked another time off camera about just how do we think it would change the society.
Yeah.
And I was telling you how some people who have experienced pandemics like this in the past, it's nothing for them to wear a mask.
That's right. That's right.
So that might be something that we start to do. I mean, it might be something, you get up, you brush your teeth, you put your stuff on, and then you throw your mask on and you go in your car and you start driving around. I mean, at this point, I really cannot say.
Yeah.
And that's the scary part.
I know. That's the scary part, is that we just don't know enough about this. Can you speak at all to, I know that, like we talked about earlier, and for those of you who are just tuning in, Dr. Day was discussing how, this can affect anybody. And so even if you're a healthy person, I mean, I'm 44 years old. I consider myself to be, take good care of myself, although I do have an autoimmune issue, which you know about. And how much more at risk are people with autoimmune diseases, are elderly people, and if you could explain why they're more at risk?
Yeah, I mean, so absolutely. People who already have medical issues, especially anything that causes inflammation in the body or causes the immune system to sort of be already primed up, definitely are more at risk because, so for example, if everybody else is at this level, but with your autoimmune disease or your inflammatory illness, you're here. Once you have an insult, you're going to go here, whereas everyone else might just go right here. So it's like if you had a car that was, the alternator, and I may be using this wrong because I'm not a car person, but the alternator was already kind of on its last leg, and a driving trip to, Arkansas was the last thing for it, then it's going to go out.
Right.
So it's just kind of like the more insult to injury you add, the worse off you are. So that would be for anybody who has any sort of autoimmune or pro-inflammatory disease. And a lot of diseases are, at the root of it is inflammation.
Right.
So that's kind of how those pre-existing conditions make it worse, especially if you have a pulmonary issue.
Which is right.
The virus is attacking the pneumocytes, the cells in the lungs, and it's damaging them. It's causing the body to make the damage. And so if you already are working with less lung capacity, you don't have much reserve.
That's right.
So you're going to get sicker and you're going to go down quicker. The elderly, pretty much, all their organs are just, sort of just running their course, and they're much older. They don't function as well as they used to, and you're not able to respond to infection because everything is just so old, unfortunately. And so that's why they're more at risk for this, or having bad outcomes or poor outcomes from the infection, because they already are at a deficit in general, just because they've been living on the planet for much longer.
That's right. So what about treatment options? That's another hot topic, because we have hydroxychloroquine, which is, I believe, an immunosuppressant.
Right, it's Plaquenil.
And Zithromax. Why is this such a controversial issue? Why can't we all just take this?
Well,
what are your thoughts?
A lot of times, we give medications and they all have different side effects. So I'll kind of go into each one separately. So Plaquenil, the hydroxychloroquine, it is a drug that is used to treat lupus typically. But it has a lot of side effects in and of itself. It can cause issues or irregularities with your heart rhythm that could end up being fatal if it's not watched. It can cause blindness. Can cause issues if you're pregnant. There's a host of other things, but those are not without its risks. So we don't want to give this drug if we don't know the benefit is going to outweigh the risk of the drug. And because we haven't had the time to really test this out, do a nice thorough study, we don't really know what's going to happen with people. So that's why we're not just giving it to everyone, because the drug itself can be dangerous. So for those patients who we're strongly suspicious to have COVID, and they're definitely having issues with oxygenation, which we know is a poor sign, we'll go ahead and give that to them. And in my small amount of patients that I've seen, it's actually making a bit of a difference. The mechanism of action, we still don't know. Could be placebo, but whatever, it's working. But the thought is that it's maybe inhibiting some of that cytokine storm. And let me back up. Cytokine is basically different chemicals that the immune system releases to let the body know, hey, we got to fight this infection. We got to do something about it. And with this particular virus, it's causing that to be so robust, and it's damaging the lung cells. So the thought is that if we can decrease some of that, because it's too much, then we could get the immune system to function at a level that's actually going to help get rid of the virus and stop damaging so much cells as a side effect, and then you'll be able to breathe and go forward from there. So that's Plaquenil. The malarial drug, I'm not familiar right off the top of my head, but I believe it causes some also dangerous side effects as well, and you don't have that much of it to begin with. But even though it's for a parasite, it's similar in that the body, the immune system is going to react when it has something that's foreign in it. So I'm not really sure exactly how that one works. And then azithromycin is an antibiotic, but it does have some anti-inflammatory properties.
Okay.
We use it in patients who have COPD. If they have what we call an exacerbation, or basically a worsening of their symptoms, we use it to also help with the inflammation of the airway, and also to help with any bacteria that may be causing extra symptoms at that time. But azithromycin can also predispose you to have other resistant bacteria in the future. It can cause bacterial-associated diarrhea, which can be really severe and deadly. It also contributes to other drugs that may cause an irregular heart rhythm, which can be fatal. So like I said, so any drug that we use doesn't come without its risk. And on top of that, because prior to this, the way that the medical field as a whole gives out antibiotics like it's candy, we're having more resistant bacteria, which is a totally different type of thing that can affect you. So we don't want to overuse the tools that we have, because we don't have that much. And so that is sort of what the hesitation is for those different things. And I don't, like I said, I don't have all the, the side effects in front of me right now, but that is the thought process behind rationing some of these pills off, because they do come with risks, and there's other implications if we overuse them.
Okay, because I know, and tell me if I'm totally crazy here, but I've thought about it, and I've thought, well, if God forbid I got it, and I was in the hospital on a ventilator, and somebody asked me if I wanted to take it, I would say, hell yeah. Hell yeah, because anything would be better than death. I mean, for me, that's my decision. Right. That's the way I look at it.
Right.
What do you think? Is that a crazy way of thinking about it, or?
No, absolutely not. And like I said, to be frank, I'm not even asking patients their permission. I'm just kind of telling them, hey, listen, I have a strong suspicion that you have it. You know, all your symptoms, and this is what we're doing. This is what we're using. And so when you're in that position as a patient, you're going to just trust who's in front of you, who has the knowledge. So I think that that's not a crazy way of looking at it. I mean, that's definitely the patients that we're using it for. We're trying to use it prior to you being on a ventilator, because we don't want that to happen.
Right.
If that is what's needed, then that's really a bad sign.
Yeah. If you go on a ventilator, are you getting off of it?
So right now I can speak to my clinical experience. We have some people who we're going to be able to get off the ventilator. They've been on it for about 2 weeks.
Wow, 2 weeks.
Yeah. And they're getting better. And, they'll be able to get off. Now, people who have respiratory issues already, sarcoidosis, which is an autoimmune lung issue, or COPD, things like that, they probably would have a harder time coming off, and you may not be able to get them off just from other mechanisms of their prior disease.
Wow. So just so you know, the chiropractor, hello, Rob, that we were talking to, says you rock. And thank you. And then Dr. Metcalf has a really interesting question.
Okay.
And, I know he specializes in medical cannabis, and he was asking, do you know if there is any research on, the use of medical cannabis as a treatment for COVID?
I don't know, but that would be really interesting. You probably should start.
I know, Dr. Metcalf, we need you to start a trial here.
You should probably start, but we already know that there's a stigma and propaganda around cannabis as it is, and there's always some reluctancy to do studies, but I would be willing to bet that it would probably be helpful, because it does help with inflammation, it helps with immunity, it helps with just your wellness as a whole if it's used properly. So I'm willing to bet that if it wasn't, I'm not going to say that it would cure, but I'm willing to say that it would probably support.
Right.
Maybe not inhale, because, that's going to cause injury to the lung, but maybe in an edible form or oil form, that way you're getting the medication or the molecule that's helping without causing injury to the lungs.
To the lungs. Yeah, I think Dr. Metcalf might have to be my next guest. I think that would be so interesting. Yeah. Thank you, Dr. Metcalf. So somebody, Asia Walls says, my favorite doctor. So this is so interesting. Okay, so let's get into some more nitty gritty stuff here. who are the people that, well, no, actually, let me ask this question. If you are an essential worker, okay, if you are still working right now, and you're coming home to a home where there's, let's say, you know, an elderly person or a child or any of that stuff, what should they do? Should they have separate entrances? Should they wash their clothes? I mean, like, what can they do to protect the people in their living environment?
Yeah. I am going to say, because I know everybody's situation and circumstance is different. So I would say as much separation as possible. So if you have the ability to have a separate entrance, by all means, you should utilize that. But if you're in an apartment or whatever, and there's only one door, I would urge you to pretty much undress at the door. Put everything in a bag. Take that bag right to the laundromat if you need to, or to the side if you can go to the laundromat another time, or take it right to your laundry machine. Put it on the hottest, longest mode possible. Then get right in the shower, wash your face, your whole body, everything. And then you can be ready to greet your loved ones who are not compromised. So if you have an elderly person in your home and they can't go somewhere else, or you can't go somewhere else, just stay as far away from them as possible. Because you definitely are at more risk to them every day that you're exposed to them. It can be very taxing because it's going to be isolating, but it's the best thing for them. You know, so if you can't physically be in a different place, or they can't physically be in a different place, just stay away from them as much as possible. For example, for me, I have a garage and then I have a front door. So I usually come in through the garage and I leave my work cloths in the garage. And then as I'm coming up the steps, I'm taking off everything. And, you know, my puppies and my children, they want to jump all over me. And I'm like, no, I have to take a shower. So I take everything upstairs, put it in the washing machine, put it on and sanitize. Then I get in the shower and everything. And then I come out and I'm like, okay, hey, everybody, now I can talk to you. So it's kind of hard because it's an adjustment, because usually when I come home, my puppy is the first one that's like, oh my God, you know, Shayla's home. Let's play. But everyone's looking at me like, where is she going? But you know, you definitely have to try to stay away. And even for me, like, I thought to myself, I thought, well, maybe I should have my children go be with someone else. But I felt that, you know, the psychological separation may affect them more. And so what I've been trying to do is just sort of distance myself from them. I'm trying not to hug them as much and kiss on them and things like that, because I don't want them to get sick. But definitely my mom, she's missing them like crazy. And I'm like, yeah, no, nobody can come see you. So the poor thing, she's at home and everyone's, you know, she's putting stuff on the porch for people to pick up. Or you're not allowing yourself to go around your mother. No, she's only 67.
She's only 67. No. Okay, guys, so, you know, think about what Dr. Day is saying here. We really have to take a lot of steps to protect the people who are most vulnerable. And, you know, Dr. Day, I don't know if you can speak to this or not. I mean, I guess I can, but I've been really worried about the emotional impact for people out there, and that's why I started doing this show. Because, you know, and your emotional impact, the difficulties for physicians who are working on the front lines like yourself, and again, I can't thank you enough for what you're doing for everybody. You know, it's so hard, like just listening to all the things we have to do. We have to take our clothes off. We have to leave, run into the, you know, we can't hug anybody until we're, you know, sanitized, and we can't go out of the house. And why do you think the medical community is not, I get so angry about it, you know, because no one's really talking about the, you know, psychological and emotional impact of this on people. And I don't mean to put you on the spot here, but why does the medical community not address that?
You know, I don't know. I can't, what I think is, we, as a medical field, we kind of separate the mental health from the physical. and we focus on trying to fix one thing, and it goes back to, you know, the way, I guess, typical Western medicine is practiced. Is you focus on an organ. If the kidney is messed up, we're looking at the kidney. If the lung is messed up, we're looking at the lung. We're not looking at the patient as a whole with their mind, body, and spirit intact. And the difference between, you know, some lesser practiced medicine, or even, I mean, I'm a DO, and it's pretty well practiced in the country, but we still sort of practice more Western type medicine, but we still think about the patient as a whole and all their different facets of themselves that are beyond their particular organ. But I think the stigma behind mental health is ever apparent, and now it's just coming out more so.
Right.
You know, I watched the news a couple of times. They did have some therapists on that were talking about ways to deal with your mental health, but it's definitely not a priority. It seems to be the priority is more so talking about the disease and the symptoms that it causes, but not necessarily everything else, which is just as important. Because if your mental health is not together, then, you know, your immune system is already going to be compromised, and
exactly.
It's going to predispose you. But I don't think many people are up on that, unfortunately.
They're not. I agree.
You know, and I think, I mean, I can see why you would be upset, because I mean, this is what you do and you're passionate about it. But I think it's really important, and you definitely have to consider that fact. However, I mean, I know even for me, like, you know, I'm off one week and I work one week, and I'm totally an extrovert. I love to go out and do things, and even me, I'm just like, oh, when is it gonna be over? And even though I know I should not go outside, I want to go see my friends, I want to go see my sister, and I want to go hang out and just be around people, but I know that it's dangerous, and I know that me being exposed to these patients, I could potentially make other people sick.
Right.
So it's just all of this in your head that you kind of have to reconcile with, and it makes it tough. And I think you're right. We definitely need to focus more on that during this time. So, you know, whatever things that you can do to sort of calm your nerves, or, you know, make yourself not be sad or upset or feel hopeless, you know, you need to do those things as much as you can, because you gotta have your mental to be able to.
Yeah, so one of the viewers asked a question. She said, Dr. Day, how do you deal with your anxiety? How do you do it? How do you do it?
So right now I'm actually, and I'm not, you know, ashamed to say this, I actually have a therapist that I go to every other week, and that definitely helps with my anxiety. It puts things in perspective. I also do different things like meditation, which I try. I'm not that great at doing that. And then I also try to just shut my mind off from the more serious things. I tend to watch more comedies, more things that are just like really silly. I read books. I color with my children.
Oh, that sounds like fun.
Yeah, I have those, you know, those, I forget what it's called. It's like those Indian little print, like paisley things. Coloring books, like I color with those, and I bought some new color pencils. So I try to do that, and music, anything that'll make my spirit light or try to get me to not think about it is kind of how I deal with my anxiety. But I think the therapy helps a lot, because it puts things in perspective. You know, for me, I always think of the worst case scenario, especially since I know a lot about the medical things, and I'm always going to go towards that. But with therapy, I'm able to sort of sit back and say, okay, well, that's probably not going to happen. And what else could happen? What is the alternative? And the alternative is always something that's more than likely that's going to happen, and it causes less stress. And so I have to sort of stop and retrain my brain to think of something that's going to be more likely to happen, that's not going to be as severe, instead of the worst case scenario that's going to be like the minority of what may happen.
Right.
So, you know, so that's what I do. At work, I'm able to more so compartmentalize. When I'm at work, I kind of don't really allow myself to feel anything, because I have to just do what I can for the patient. I can't get too emotional. but at the end of the day, I'm exhausted from that. And then I kind of have to just let it all out and release it, because if I don't, then it ends up making me sick.
Right. And I think that's true. And on that note, Michelle asked a question, Dr. Day, for those of us still working, what precautions as employees should we take while working with the public? Good question.
Yeah, I mean, I can't see a job that would not allow you to wear a mask and to carry hand sanitizer or be able to sanitize your area. Try to stay away from your coworkers and the clients that you're serving. I know I went to go pick up a medication for my son yesterday, and I was at CVS, and in my mind, I knew to stand back, but they actually put a table in front of their register, so you couldn't get that close.
That's a great idea.
So they put a physical barrier. So I think any way where you can distance yourself without compromising the service that you're given and without compromising yourself should be done. So I don't know what you do for work, but if you're able to put some sort of barrier between you and your clients or you and someone else, that's probably the best thing. And of course, wash your hands, sanitize your area. You might want to wear a couple of masks for your shift. I mean, you probably should only be wearing it for maybe 2 hours at a time. So if you have multiple masks, try to keep up with those. If you have, I know a lot of people have been sewing masks and wearing those. I mean, obviously you're not going to keep changing those out, but you would need to wash those every night. And just try not to touch your face, which is hard. And then those cell phones, wipe those cell phones.
Yes. The cell phones I do with a couple times a day with alcohol. And listen, one of my friends, God bless her, I know she's watching, she's awesome. She bought me something called phone soap. And it's an antimicrobial light that times itself for 10 minutes at a time. I'll ask her where she got it. And so when I come in, every time I throw my phone, my keys, my glasses, because all the things I know that I'm touching, I go over them with alcohol and I put them in this light because I'm trying to do everything. So I think if you're still working, you might want to invest in something like that. Take it to work with you. Do what Dr. Day is suggesting, maybe multiple masks, putting the barrier of the table so you know exactly what 6 feet is, or put a marker in the carpet, like a piece of colored tape, and don't come near this line. And I mean, to me, it's a scary time. And I think if we don't really start taking this super serious, even those of us who are out there, we're really hurting the nation. We're hurting everybody, our neighbors, our loved ones. So that was a good question. We have another question coming in. I don't know if you can answer this or not, but realistically speaking, are we looking at June or July to return to quote unquote normal, or is that impossible to answer?
Well, I'm hoping, I'm hopeful that June or July will be back to some normalcy. I definitely expect like the next 5 weeks to be really bad.
Okay.
I really suspect that I'm going to start seeing a lot more cases at work, where the hospital is going to mostly just be coronavirus infected patients. And then it should level off. So I think we've got another good 5 weeks for craziness and severity, and then it should start to taper off. And so I'm hoping that we do get a reprieve around July and August, because flu season starts back up again at the end of September, October. So then we'll be right back into that again, and with all the other pneumonias and everything else.
Oh,
so
boy.
Will we get that much of reprieve? But I'm hoping so, because it's just a lot, and I function better if I have an endpoint. So
I think we all do. And I think that's why we're all so damn anxious, because we're wondering, like, oh my God, how long is this going to last? And every 2 weeks, it's going to be another 2 weeks and another 2 weeks. And, there's so many implications that come out of us staying at home and not being able to work and sheltering in place, emotional, financial. Yeah. So thank you for that question. So our next question, Dr. Day, we're really giving it to you today. And there's more coming. Since this virus can reoccur, are we going to have a vaccine available, and how soon? And thank you for that question.
Yeah, so right now they are, the scientists that make vaccines and such, they're working on a vaccine now. But typically it takes about 2 years or more for a vaccine to actually be safe enough to start to administer. I don't know if you guys remember back to, because there was a time when we didn't do flu vaccines.
Right.
And even when the flu vaccine came out, there was some safety precautions. I don't remember exactly what it is, but I remember, at the time not wanting to let my daughter get one because it was like a nasal one for children under 1 or whatever the age was. And then I kind of was reluctant to get one for myself because it was a new vaccine. We didn't really know about it. And then the fact that the flu changes every season, that the vaccine would always be a season behind. So I think that they are working on a vaccine right now for the coronavirus, this particular one. And it probably won't be ready for a couple of years, to be honest with you, because they find people to participate to find out if it's safe and if it works. And so, that comes with steps of the way the research goes and how clinical research has to be done. And then you also have to have enough people to have enough data to show whether it's worth using, because you don't want to give a vaccine prematurely that can then cause more harm than necessary. So we're probably looking at 2 years before we come up with a vaccine. I definitely suspect that this particular virus is going to probably come back on a seasonal basis, just like with the flu. And once we do get a vaccine out there, it's probably going to be something else that you would get with the flu vaccine, and you would get your coronavirus vaccine as well.
Wow. So now, I don't know, if this is pertinent for this situation or not, but when my mother was under chemotherapy, when she was going through some really heavy cancer treatments, and she would want to travel in between the treatments, her oncologist told her to put Neosporin on the inside of her nostrils before she ever got on an airplane. Does that sound like something that maybe we could do that could potentially, I guess we don't really know, but could that possibly be helpful?
Oh, that's a good question. I'm talking, you're on chemotherapy, you're definitely going to be more just predisposed to bacterial infections. So the Neosporin is an antibacterial ointment. But I know that MRSA, which is methicillin-resistant Staph aureus, is carried in the nose. That's the bacteria that can infect the skin, the lungs, and etc. And the thought is that, Neosporin or something like that actually wouldn't be resistant to, it wouldn't be effective against that. But if you had a barrier of some sort of antibacterial thing other than just Vaseline, but a barrier, if you will, that would allow things to adhere, it would get stuck to the petroleum in the Vaseline or the ointment, that would, I guess, be another level to help protect you from getting things in. Because you definitely do have physical barriers in your immunity, like the hairs in your nose and the hairs in your throat that make you cough and stuff like that. So that potentially could help. I don't really know, because I'm just surmising on what his rationale was.
Yeah.
Like a barrier to protect you.
Yeah.
But
so
it would kind of basically be the same as wearing a mask.
Yeah. So, I guess that, from what you're saying, I think in conclusion from everything that we've talked about today, and if anyone has any more questions for Dr. Day, please put them up now, because we're going to have to wrap this up in a couple minutes. But, right now what you're saying is, of course, everybody stay home unless you have to go out.
Yeah.
If you have to go out to get groceries, make sure after everything you touch, off the shelves, every couple things, go ahead and Purell your hands, sanitize your hands. One thing that someone asked that I forgot to ask you on that line is, should we wash our groceries when we take them out of the bag?
I mean, it couldn't hurt. It couldn't hurt. I do know that viral particles will stay on harder, smooth surfaces more than they will fibrous stuff. So they're not going to stay on clothes as much as they would something plastic. So if you've got something that you bought that's hard plastic or hard metal or glass, they can definitely stay on that. So if you want to sanitize that, you definitely can. Of course, all your produce, you're going to be washing that anyway. So you wouldn't change that so much. But the paper and like cardboard, it's not going to really survive on that as much as it would something that is smoother, like a glass bottle, a jar, a can, something like that. So it's going to stay more on those. And for those of us who like to save our grocery bags, I've just been throwing mine away now. I don't save them anymore.
Yeah.
I don't know if that's good or not, but I've just been throwing them in the trash.
I think that's smart. That's smart.
Them, and I'm like, we're going to just throw those away. But I think if you're thinking about that, it couldn't hurt to, get rid of those different particles that might be on those smooth surfaces.
Yeah, I think that's really smart. So Derek says, I have been using Clorox wipes on all my groceries. So I guess that's a great idea.
That's fine. Yeah.
It's not going to hurt, like you said, and definitely from what you're saying. I mean, this has been so informative. Thank you so much. I'm learning just from listening to you, because I haven't been washing any groceries, and actually last night for the first time I said to Rob, like, hey, wipe down the bags of the rice or something like that. And so it's starting to, I think, kick in now that we really are better off safe than sorry, and we really need to just do everything we can to just be on the side of caution at this point, because we know so really little about this virus. And so I think to, just kind of, again, conclude and wrap it up, wash those groceries, especially glass surfaces or any canned goods, anything that's a hard surface. Continue to, if you're an essential worker and you're still working with the public, we talked about, Dr. Day talked about all the different things you can do to protect yourself in that environment, but to really, come into a different entrance, use a different bathroom, stay away from any vulnerable people in the household. And, one of the things I didn't ask you that I think someone else asked, and I want to make sure we get this in before you leave, is if we think that we've been exposed to somebody, what should we do?
Yeah, so that's a really good question. So I think you could divide it into symptoms and then no symptoms. So if you think you've been exposed to someone, but you're not having any symptoms, I would just, as much as possible, try to self-isolate for 14 days if you can. If you're not working, that shouldn't be hard to do because you're not at work anyway. But if you are working and they're requiring you to get tested, then you would just have to go ahead and get tested even if you don't have symptoms. Now, if you think you've been exposed and you have symptoms, meaning you've got a dry cough or a fever, sore throat, general malaise, meaning you feel really tired, like you've been hit by a Mack truck, something like that, start monitoring your fever for sure. If you can get access to a pulse oximeter reader, it's a little device that you put on your finger. You can probably get it from Amazon or the drugstore to check your oxygen. 95% or more is considered good. Anything less than that might be dangerous, especially if it's less than 91%. If your oxygen level is going to go, if it goes below like probably 92% and you're not feeling that you can breathe really well, you need to go to the emergency room right away, because that is a sign that it's really affecting your lungs. Now, it could be a different type of pneumonia. It doesn't necessarily have to be the coronavirus pneumonia, but that is a sign that you need medical attention right away. You can probably last this out at home with a fever for a couple of days, but I would say if you have a fever and a cough and you think you've been exposed, it doesn't hurt to go get tested.
No, it doesn't.
Because, and I don't care what they're saying about they're running out of tests, this, and the third, go get tested, because the sooner we can identify you and put you where you need to be, the fighting chance you have to survive this. So I definitely wouldn't sit at home waiting to see what's going to happen. If you've got fever, cough, you're feeling general malaise, you have shortness of breath, definitely just going into the ER or go to one of those testing facilities. I mean, I would just go to the ER because the testing facility is not going to be able to do anything but do your tests. They're not going to be able to treat you if your vital signs are off. And if you're not in the medical field, you don't even know what I'm talking about. Like, if your heart rate's fast, if you're breathing too fast, or too shallow, or if you're confused and things like that, just go ahead and go to the emergency room. Don't even bother with urgent care. Go right on to the hospital.
To the hospital. Okay, so everyone, just make sure you remember what Dr. Day just said. Shortness of breath, fever. Go to the emergency room. Why risk it? Why risk it? So we have interesting. We've never tracked a virus. Viruses come and we accept it. This, however, has daily world attention.
Oh, except for, HIV kind of did, but not as much as this, I don't think.
No, but I mean, this one's so deadly, and I think that's why. I mean, it's and we didn't.
Yeah, and it's like, with HIV, it's like you're making the choice to have sexual relations with somebody, whereas this, you're just going on minding your own business. And did not choose to interact with XYZ person, and you could potentially come down with the virus. So it's a totally different thing.
Yeah, and this is really scary. We're getting a nice compliment. Thank you to beautiful women for all the important information you're providing. Thank you. Thank you. We always like hearing that kind of stuff. Well, you're welcome. And I want to make sure, is there anything that I missed, Dr. Day, that we should talk about, that you want to bring up, or that any of our viewers want to ask before we kind of wrap it all up? I think we covered everything.
Yeah, I think we did, actually. Did a good summary.
Well, will you come back as we go on through the weeks? Like, we could have you on maybe, once a week, and and then you can keep us up to date, and we can also keep track and make sure that you're okay. Because if anyone's just tuning in, I unfortunately, you can watch us on the replay, but Dr. Shaila Day has been with us. She's working on the front lines in Atlanta, and she's treating COVID patients, and we're getting come back, please. Yes, she will come back. She promises.
I will.
But, I love you, Shay. I'm thinking about you. Please be safe out there. And everybody heed the information that Dr. Shay relayed to us today. Please be safe and protect the people that you're with. And thank you, everybody, so much for watching. And I'm going to say goodbye to everybody and share this video. Check it out on the replay. Share it with your friends. There's so much good information. And, you guys got to talk to Shaila directly, which none of us get to do. And that was something that, I'm watching the news and I'm like, I want to ask a question, and you can't. And they seem sort of organized, and they don't seem authentic. And this was the real story here. So thank you, everybody. Shay, you hang on 1 second, and I'm going to finish the video. Goodbye, everybody. Thank you, and be safe.